Speaking of the language, so this is the more basic ways to talk about language, but there's also a more detailed one. So one area that is involved is the Wernicke area. So Wernicke area is in the temporal lobe and close to the occipital and the parietal lobe, and the Wernicke area is receiving information from the primary visual cortex and visual association area, so for the things that you can see, for example when you read something, um, and also it should receive information, it's not shown here, it should receive information from the auditory area for things that you can listen. So Wernicke area is important for comprehension of written and spoken language. Then Wernicke area is connected with the Broca speech area, and this is for vocalization. So this is connected with the motor cortex vocalization area, and this is for movement of larynx. But Broca's speech area has a bigger function, so it's responsible for the amount of air that is coming from your lungs. So movement of the vocal cords and a movement of the tongue, movement of the cheek and the jaw during speech. So all of them are coordinated by the Broca's speech area, and they are connected to each other by the arcuate fasciculus, which was part of the superior longitudinal fasciculus, which I talked about it before, that I will come back and talk about it. So this is the area, and if this is damaged, then the person is not able to repeat what they were saying, so they have this problem. In the Broca's motor aphasia, Broca is in the frontal lobe, so it's a motor. They have difficulty speaking, so they will understand things, but they have a difficulty saying things, and if they say something, it will be difficult for the other person to understand. They have also contralateral weakness of the lower face and arm, and they have sympathetic apraxia of the left hand. So they have different symptoms. Most of them are related to the movements and speech. In the Wernicke, it is sensory, so that is for the difficulty understanding word, difficulty finding word, and they may have difficulty understanding what they read. So this is more sensory, but they can talk properly. This is a more detailed part of the language. So we can start from here. So again, this is the central sulcus, this is the precentral gyrus, which is the important for voluntary movement, and that's for execution of speech. So you have to make a decision when you talk, and then this is the execution of speech. The middle frontal gyrus is responsible for retrieval of the word. The inferior frontal gyrus is responsible for syntax. And the temporal lobe, different parts has different functions. So the anterior part of the superior temporal gyrus is responsible for construction of some phrases. The middle temporal gyrus is responsible for comprehension of word, and the inferior temporal gyrus together with the inferior occipital gyrus is responsible for recognition of the people and objects. So people are more anteriorly and objects more posteriorly. The visual cortex, visual association area, this is for understanding and seeing anything that is there, visual stimuli. The posterior part of the temporal gyrus and the inferior part of the parietal cortex is responsible for the short-term auditory memory. So as you can see, the frontal lobe is involved, temporal lobe, parietal, occipital lobe, they are all involved in different aspects of the language, so it's very complicated.